AI safety is simply making sure that AI does not harm humans. And this is not in the way like you immediately think. This is not in the way that, oh, I'll make sure that if the AI gets out of control, we'll put it in a cage, or I'll prevent super AGI. No, this is simply in a way that we want to make sure that when we are using AI, we are using it in the right way. We are not adding more biases than there are. We are not making a situation worse than there is. And a very simple example in healthcare would be that if we have created an AI to diagnose a patient or find cancer in chest x-rays, we simply want to make sure that the AI is validated, tested on enough examples, and that it is working as it should, that it is not missing a diagnosis, because if it misses something, a patient goes undiagnosed and the AI is harming humans. So like harm in that way, if that makes sense.
Yeah, I mean, there's a gray area though, right? So one side is just poor performance of the model / biases, right? So like, for example, all these models trained, I think, the skin cancer one is the best example, because a lot of these data sets don't contain people from ethnic minorities or people with dark skin. So a lot of these skin models designed to detect skin cancer, they realized in studies that it's a lot more sensitive and specific to people with paler skin types and white skin, whereas the darker skin types don't get picked up as much. So that is a risk, and that is safety. But how do you balance it between just saying, oh, this model's a bit biased and performs poorly in this demographic, versus saying that it's unsafe?
No, I think that is it. That is the safety concern there. Like exactly the example you mentioned is a safety concern. That model would be unsafe if deployed. Not because unsafe because it will overtake a hospital. No, unsafe because it will bring harm if it is used. So I think that's the main point of AI safety.
Yeah, sure. I mean, the catastrophic risks are still there, but like you said, it's very minute, low chance. But yeah, I guess that's not what most people are talking about when they talk about safety.
That's what, yeah, exactly. That's what most AI people, when they are talking about, or computer science people, when they are talking about AI safety, they mostly mean these in 99% of cases. And I think this is the risk we should be talking about today, and this is the concern we should be talking about today. The super AGI, sure, we can dedicate a bit of resources to that also, but I think that can be left for a bit later. And now just make sure that the AI models that we are using are used in the right way for the appropriate use case and are properly validated.
Yeah, and can I just make a small point here between AI safety and AI regulation? Because there is a distinction, right? AI safety is, as you mentioned, deploying models that are unbiased, that perform well, that don't lead us into blind spots that can harm patients or users. Whereas AI regulation is a bit different. Theoretically, you can get a really bad, crappy AI model that's been approved for regulation, right? As long as that fits the intended use case. So regulation's a bit different. Regulation's about jumping through the hoops, getting those tick boxes in, about data structure and performance to a level that the regulators are happy with, and that can differ from country to country, right?
Yeah, but I mean, shouldn't that be the same? Like, shouldn't AI regulation be there to ensure AI safety? I mean, why are the hoops then there? Why are we jumping through these hoops? What's the reason for them to exist?
Yeah, but regulation, I agree there's a significant overlap, but the regulation really boils down to the intended use case statement. So, what that model is for specifically. So I guess if you specify this is a model that is to be used in this very niche demographic, theoretically it can be regulated. Like, it could pass regulation, but it wouldn't necessarily be safe in the general setting, if that makes sense. But
Yeah, I mean, but also you wouldn't use it in a general setting. I mean, I really think that they should be working together, like, because then I don't really get what's the point of regulation if it's just there to, I don't know, get a model approved.
Yeah.
I think the main point should be that I do the regulation points so that someone using that model can be sure that everything is fine. If I jumped through all the hoops, then that model can be used for the use case someone wants.
Yeah, fair enough. Yeah, I mean, I think you're right. Like, they should be aligned, but I think I just wanted to make the point that they aren't always aligned.
Yeah,
and just because something is regulated doesn't mean it's safe.
With that, I agree, and that's something like we should change. That's something I think we should work on so that the regulations is really reflecting the safety of the model or the purpose of the model.